A diagnosis of chronic lymphocytic leukemia can be overwhelming, but advances in cancer research, including targeted therapies, have paved the way for more precise treatments. And it's also known as CLL, which is one of the most common blood cancers in adults. And because its progression varies from person to person, choosing a tailored treatment plan, obviously crucial. I'm so happy to welcome in today, joined by Lynne first, who's going to share her personal journey with CLL, and Dr. Nakhle Saba as well. Welcome to the both of you. Dr. Saba, I want to jump in first. Tell us a little bit more about CLL, how it does differ from other types of leukemia. My apologies if I pronounced it incorrectly as well, but tell us a little bit about it.
That's okay. That's why I'm here. So this is chronic lymphocytic leukemia, or CLL, as you abbreviated it. So this is the most common leukemia here at home in the United States in adults. At diagnosis, most patients are not really feeling much. I mean, they go to their primary care and their white count is elevated, or they might have a lymph node or so. But as the disease progresses over time, patients start to feeling it. And this is when they sit with a doctor and decide on a treatment strategy that is tailored based on multiple factors, particularly the CLL risk status. Some of those patients with CLL have high risk features, and they have to be treated a little bit differently than others.
And Lynne, I want to bring you into our conversation here. Let's talk about when you were first diagnosed. Initial thoughts. I mean, obviously, you've heard of other cancers with the same words, and I'm assuming that those were first emotional, but then you had to learn a little bit more about CLL, I'm assuming.
Absolutely. It was a foreign word to me. I never heard of it. And of course, getting the diagnosis of cancer after feeling well your whole life is scary. So yeah, I had to learn a lot about it. And I did. I delved right into it and learned as much as I could about the disease, because I do believe that knowledge is power for everybody.
Oh, for sure. Dr. Saba, what are some of the key advancements when it does come to treatments, and especially, as you said, the importance of tailored treatments when it comes to CLL?
Totally. The treatment for CLL has dramatically changed over time. I can tell you that, and that's thanks to research. The drug class that I'm very excited about, that shaped and continued to shape our treatment strategy in CLL, is called BTK inhibitors. So this is an orally bioavailable medicine that's inhibit BTK. So what is BTK? This is a protein expressed inside the cancer cells and help them to grow and spread. So we're closely working with B1 Medicine to raise awareness of CLL and to discuss sanubrenib or Brukinsa, which is a BTK inhibitor that works particularly well in the high-risk group. But if those patients are on this drug class, they have to talk to their doctor about possible side effects, such as bleeding, joint pain, and drop in their blood count. So talk to your doctor.
And of course, Dr. Saba, we're going to share the website on the bottom of the screen right there. Lynne, I'm going to give you the last word here. Let's talk about how your outlook has changed, and of course, how you're doing since you've started this treatment, and perhaps any advice you would like to share.
Thank you. I'm doing well. I'm almost on 3 years of Brukinsa, and I'm feeling fine. And the best I can say is to every patient, advocate for yourself. Be your own advocate. Be powerful. Learn about what you have, and don't be afraid to ask questions. Best advice I can give any patient.
And you know what? That's great advice. Thank you to the both of you for your time today. And I hope we were able to educate and help some people at home. Take care and stay well, okay?
Thank you. You too.